Welcome to Nursclex, Enhancing Critical Thinking. This is lesson number 2, Menarche Concept Map. Concept mapping is a visualization tool that will help you organize your assessment data. It will also help with identifying patient issues, determining the nursing diagnosis, as well as nursing interventions, and lastly evaluating the outcome. After the concept map lesson is complete, there will be a Q&A study session to help recall the information from the concept map lesson. Now let's begin our lesson. Today's topic is about menarche. Defined as the first occurrence of menstruation, the average age of menarche is about 12.5 years, but may occur between the ages of 8 and 16. For about 2 years before menarche, a girl experiences a series of physical changes as her body develops. Cycle length is calculated from the first day of one menses to the first day of the next menses. In the beginning, it may be irregular and unpredictable for the first year. Once established, the cycle is about 28 to 30 days, but the normal length may vary from 21 to 35 days. Cycle length often varies by a day or two from one cycle to the next, although greater normal variations may also occur. The average amount of flow is approximately 25 to 60 milliliters per period. Usually women describe the amount of flow in terms of the number of pads or tampons used. Flow is often heavier the first couple of days and then becomes lighter toward the end of the period. Menses usually lasts from 3 to 5 days, although the length may vary, it may last up to 7 days. Nurses should suggest to women to change pads frequently, every 3 to 6 hours when awake, regardless of the amount of blood that is absorbed. If a woman reports that she has oversaturated a pad every 1 to 2 hours for 2 to 3 days, she may be experiencing a gynecologic problem, requiring further evaluation. Heavy menstrual flow is a leading cause of anemia. The use of superabsorbent tampons has been linked to the development of toxic shock syndrome (TSS). Toxic shock syndrome is a rare, life-threatening complication of particular bacterial infections. Some symptoms of TSS are a high fever, low blood pressure, vomiting, and rash. Women may prevent problems by using tampons with minimum absorbency needed to control menstrual flow, changing them every 3 to 6 hours, and avoiding using them for vaginal discharge or abnormal bleeding. A woman may want to use tampons only during the day and switch to pads at night to avoid vaginal irritation. If a woman experiences vaginal irritation, itching, or soreness, or notices an unusual odor while using tampons, she should stop using them and be evaluated for infection. This completes the menarche concept map lesson. Now on to the Q&A study review. Question number 1. What is menarche? It's the first occurrence of menstruation. Question number 2. What is the average age of menarche? 12.5 years, but may occur between the ages of 8 and 16. Question number 3. How is the cycle length calculated? Calculated from the first day of one menses to the first day of the next menses. Question number 4. How many days is the cycle length? 28 to 30 days, but the normal length may vary from 21 to 35 days. Question number 5. What is the average amount of flow? Approximately 25 to 60 milliliters per period. Question number 6. How long does the menses last? Menses usually lasts from 3 to 5 days and may last up to 7 days. Question number 7. How frequent should women change their pads when awake? Every 3 to 6 hours. Question number 8. What is oversaturation? Oversaturation of a pad every 1 to 2 hours for 2 to 3 days. Question number 9. Is oversaturation a problem? Yes, a gynecologic problem, requiring further evaluation. Question number 10. Heavy menstrual flow causes which issue? Anemia. Question number 11. Define toxic shock syndrome. Toxic shock syndrome is a rare, life-threatening complication of particular bacterial infections. Question number 12. How often should women change their tampon? Women should change them every 3 to 6 hours. Question number 13. When should a woman not use a tampon? A woman should avoid using tampons for vaginal discharge or abnormal bleeding. Question number 14. To avoid vaginal irritation, what should the nurse inform the woman on tampon use? Use tampons only during the day and switch to pads at night to avoid vaginal irritation. Question number 15. What are the signs of vaginal irritation? itching, soreness, or an unusual odor. This is the end of the Q&A study session on Menarche. Thank you for watching this video. Don't forget to like, subscribe, and click on the bell notification for future videos. Any comments or suggestions for future videos, please comment below.